fabulous advance in laser cosmetic treatments is the addition of fractional lasers. Now there's two types of fractional lasers, one that burns your skin off and one that doesn't burn your skin. And patients prefer the one that doesn't burn the skin because they have less of a wound and they actually can have an equally good result with a series of treatments. So this is safe to add at the same time as the Max G treatment, which makes this different than most other systems that you'll work with. So we've done part one, which is the Max G. Now we have the Fractional 1540, and there's two tips for this. I should point out that these are not disposable or consumable tips. You just buy them once and there's no ongoing cost. And I like to own my equipment. I don't want anyone raising prices in the middle of my treatments. So this is the XF, which stands for extra fast tip. It's got a hexagonal lens, a complex multi-lens array, and every time I fire there's going to be 480 little micro beams that will hit under the treatment area. These are microscopic injuries to the skin that will coagulate the skin. So we're going to start with the XF tip. Now if I had a patient in the chair who perhaps had acne scars or surgical or traumatic scars, then we actually would use the extra deep tip. So this tip comes off and the extra deep tip can actually be inserted. And you can see the tip on the extra deep tip is quite different. It's got 49 little pins, and what this does, and I'll just demonstrate without firing, this actually pushes into the patient's skin, displacing the water, allowing for the energy to go deep. Deep energy is necessary for scars and stretch marks, not for general resurfacing and complexion blending. And that depth of energy pushes water out of the dermal epidermal junction, and that actually spares an injury at the level of the melanocyte, and it minimizes and almost eliminates post-inflammatory hyperpigmentation, and that's one of the common side effects of fractional non-ablative wavelengths. So this is a great advance because we can deliver energy deeply and we can minimize hyperpigmentation. And I use this for stretch marks as well as scars, all types of scars as mentioned. Thank you. So we're going to get going with the treatment with the XF tip. So for our energy, we're going to set 15 milliseconds. You can choose 10 or 15. And I'm going to do a moderate energy. The more energy I put on, the deeper the beam goes. And I actually don't really want to go deep. Most of her issues are complexion related issues. And Laura actually, even if she had darker skin, even up to skin type 6, African American skin, I could still use this handpiece. I would just lower the settings. So I'm going to go with 15 and 34. I'm going to adjust the hertz so I can go as fast as I can so she can go home and we can move along. Now I'm going to put it in ready and we'll advance. And now we're going to get started. So I'll turn your face this way and we'll start right where we left off. 15 and 34 at 1 hertz. And we're going to start, I'll do 1 pulse. Okay, that's what it feels like. And we'll just march along. How you doing? I'm using a fair amount of compression. There is a sapphire lens with some cooling at the end of this, but the cooling on this handpiece is not as critical because it's a micro beam laser, micro injury to the water in the skin. And I'll have Jessica hand me a gauze so I can keep the lens nice and clean. We want to keep that lens nice and clean so there's no debris or oils or dead skin cells coming off on the lens. So I like to do a 50% overlap in all directions. Part of the reason this is extra fast, you can see it's firing at 1 hertz. You could probably even go a little faster, but my hand can't go faster than that, so 1 hertz is comfortable for me. It also has a high density of beams. So 1 pass gives me a 7% coverage of the skin. And if I do 50% overlap, I get about 14% coverage. And that's about what I want to get. For the general skin, over the keratoses, I actually would do a 2nd pass. So we would double that and get 28% coverage. And your eyes are fine. You do want to make sure you go over the lateral orbit. We're always over orbital bone, as I mentioned. But this improves skin texture. And we do get a little firming up of the skin. So it can help with a little bit of laxity. And just one extra pass over those keratoses, because we want to get a higher density so we can get better absorption there. Good pressure on the skin. I'm using moderate pressure. That way I don't have a phenomenon called arcing. Arcing is when you lose contact with the skin and the beams kind of scratch across the surface, but they don't go into the dermis. The other thing is that we don't worry about hair loss over the treated area. So if we're treating over a male beard or the corner of a female brow, there's no target here for pigment. With the Max G, because we're targeting pigment, if you're treating over a male beard, you can get some temporary hair reduction. But the wavelengths are not enough to cause permanent hair reduction. Because remember, there's two other handles on the icon that can also be used for laser and light-based hair removal treatments. And the forehead's a little snappy, so hang in there, you're doing great. I always like to make sure I go over the glabellar area. Now, I would never do this treatment on the same day somebody had a neuromodulator put in, because you don't want to cause inflammation and cause toxin migration. So all of us good folks have neuromodulators. Laura's no different. She's been in for some treatments with Botox and Dysport, Xeomin, etc. And so as long as it's been 2 weeks and the neuromodulator has kicked in and it's already activating the neuromuscular junction, you can go ahead and do this treatment very safely. And in fact, it's a nice complement. Most of our patients have neuromodulator followed by the skin treatments, and they get enhanced results. Over this way. I just lift up my glasses to see the end point. I'm very pleased. I'm going to come just on the side of your nose here. Ready? A little snappy. Ouch. And the nose is very sebaceous. You want to make sure you wipe any oils off your lens. I like to keep that nice and clean. And sometimes it helps if you actually, technique-wise, if you push the tissue up under the tip. Just coming across the chin. And then we'll save the upper lip for last. Definitely want to treat around the corners of the mouth because you can get some lifting of the depressed tissues. She's doing a great technique of pushing her tongue under my tip so we get nice tension. It's nice to get the patient involved in your treatments. And last part, we're just going to go right above the upper lip. So you want to take your tongue inside your mouth and cover your teeth. And we'll start over here. Perfect. Little ouch. It's always snappy. The upper lip is one of the most sensitive areas on the body. Okay. She looks fabulous, so I'm just checking for any skip areas. I do want to do one more pass over here, which we did not do, and then we'll finish up. So I always like to let the patient know what to expect, and we're nearing the end. Okay, so laser goes into standby. Safety glasses come off for the operators, technicians, as well as the patient. And she's loving her Zimmer chiller, but we may bring in the ice pack and the roller. She's gonna feel like she has a sunburn now. Is that how you feel, Laura? Like you have a sunburn?
No, it just feels tight.
Tight, okay. So she's experienced a sense of tightness. That's from the edema. So the wrinkles will go away immediately because of all this edema. And of course, that's a transient reaction. But you can see a beautiful endpoint on her lentigines, on her nose. Her keratoses have darkened some. We have nice diffuse area of treatment. We did a good 25-30% density, so we can expect a good percentage of these keratoses to be coagulated and to pick off over the upcoming weeks.